like to begin by asking you about circumcision, okay? Because a lot of people in Kerala are very curious about this, about the tangible, the so-called health benefits of circumcision. Does circumcision offer any tangible health benefits?
So first off, I want to start with the conversation on circumcision. I always want to start the conversation for circumcision being, circumcision is an elective procedure. There's a lot of different reasons to do it. I'm Jewish, so culturally, that is something that we do. We do a circumcision, we do a bris. That's part of our culture. I do think that it is an elective. It is a decision for people to make. I'm not here to tell you you should get circumcised or you should not get circumcised. I want to be very clear on that. So one thing, though, that we do see is there are potential benefits of getting a circumcision. Okay. Those benefits, especially in places where the data is showing, third world countries, like places like Africa, where there's high HIV rates, there is data suggesting that circumcision reduces the risk of sexually transmitted diseases. It reduces the risks of HIV, reduces the risks of herpes simplex, or HPV, which is human papillomavirus. These are all sexually transmitted diseases. And when we're talking about things like HPV, these things, we think about HPV often for women because it can be a risk factor for cervical cancer. But for men, it can also be a potential risk factor for, anal, rectal cancer. It can be a risk factor for penile cancer. And penile cancer in a circumcised person is very, very low. So those are some of the benefits. Additional things that some people have an indication, or urologists at least have an indication, especially in younger boys, very young boys who have recurrent urinary tract infections. One thing to prevent the urinary infections is to get circumcised. And that's another thing that is a potential benefit. And so, there are indications and reasons to get circumcised. There are potentially health benefits. The argument is, though, that some of that data doesn't necessarily translate to other, parts of the world. But, there is data supporting these kinds of things for circumcision.
Yeah. Also, another question which many men have on their minds is whether it will reduce or enhance penile sensitivity and sexual pleasure.
That's a great question. This is very important because I think you need to understand that there's been a decent amount of studies on this, and a lot of guys are worried, or not even guys, parents are worried that by doing a circumcision on a child, you are potentially depriving them of some kind of penile sensation, decreased pleasure, and some people to see it as mutilation for that reason. Now, I personally do not see it as mutilation. Everyone has their own beliefs. And once again, I'm not going to tell you need to circumcise your child. The data does suggest, though, that there is no difference in penile sensation in a circumcised versus uncircumcised person. Now, I will tell you, having circumcised a lot of adults for several reasons, there's other indications to do a circumcision in an adult, and we'll probably get into that. But out of all the guys, I've circumcised hundreds of men at this point, no one has ever come back and said to me that sex is different or sex is worse, that there's no associations with erectile dysfunction, there's no associations with orgasm issues. So if your concern is a sensory thing, I would say that's not going to be a problem. After you do get circumcised, though, as an adult, you may have a hypersensitivity temporarily to the tip of your penis, what we call the glands, because it's not used to being exposed to the outside world. But in general, the data suggests that there is no significant difference in sexual satisfaction before or after a circumcision.
Okay. So, doctor, a related question to this is because men are concerned about how women experience sexual pleasure. Do women have a preference for men with circumcised penis or not?
It's a great question. And I actually wasn't sure about this. I had to go look this up myself. And there is data suggesting that women do prefer a circumcised penis in men. And the data suggests, because they see it as a little bit more hygienic, they think that there is a reduction of risk of getting an STD and things like that. So I think for many of the reasons why we described, why people may want to get a circumcision, that's one of the many reasons why women perceive a circumcised penis to be more preferable. Now, once again, this is a generality. I have talked to plenty of people in my life, men and women, who prefer uncircumcised penises. So I would not say that this is all women prefer a circumcised penis. That's absolutely not true. I guarantee a lot of women don't care, or a lot of women do like an uncircumcised penis. But the data does show in general, women do prefer a circumcised penis.
Okay, so it's more of a subjective experience, I guess.
Of course. And I think it goes back to it's not about, the size, it's about how you use it. It's not about how it looks, it's about how you use it, right?
True. Also, doctor, there are situations where you really require circumcision, right? Some medical situations. Can you explain a little bit on that?
Yeah, one of the most common reasons, there's two very, very common reasons. One is called balanitis. You get recurrent balanitis, which is infection of the tip of your penis, which is like the glands. And sometimes the foreskin, for whatever reason, can start getting irritated. It can cause an infection of your penis, like a superficial infection. It's not deadly. But it's problematic. It's annoying. It's not fun. It's uncomfortable. And recurrent infection of this area signifies that maybe it's time to get a circumcision. Another thing that could be a source of requiring circumcision is something called phimosis. Now, phimosis is scarring or tightening of your foreskin where you're unable to retract it, or it causes some cracking or some painful cuts in your foreskin. And sometimes we can conservatively treat that. I often give a steroid cream for about a month, something called triamcinolone cream, or clotrimazole cream. And it often does work, but for certain situations, it doesn't resolve the issue. Some people have had this issue for a long time. They haven't been able to retract their foreskin or see their penis or see the tip of their penis even for years. And I see guys like this all the time. And for those guys, a circumcision is absolutely necessary. If you can't keep your penis hygienic, if you're putting yourself at risk for infection, for STDs, for inflammation, which can result in penile cancer. So I think when it comes down to hygiene and things like that, that's definitely an important indication for you getting a circumcision.